In the heart of Nassau stands a beacon of medical excellence, Doctors Hospital. Established in 1955 by Dr. Meyer Rassin, this institution has been at the forefront of healthcare in the Bahamas for 7 decades.
The common thread from day one is the need to have good quality healthcare. My dad was in the government hospital at one point doing surgery. He asked the nurses to cool the room down. It was too hot. Everybody was sweating. Too hot for the patient, too hot for surgery. And the nurse opened the window. And at that point, it triggered him that we need better healthcare. We need that better ability to provide the support and protection of our patients. So that was the day he said, all right, I got to build a clinic, a hospital that can provide the kind of quality of services from my patients that I want.
Founded as the Rassin Hospital, it was the most modern facility in the West Indies. In 1986, Bahamian physicians acquired and renamed it Doctors Hospital.
Understanding the doctors of today and being clear on how I perceive the doctors prior, the doctors that preceded me, would take us all the way back to 1955 when Dr. Meyer Rassin decided to build his practice and to build the hospital. And his dream is based on elements of the same thing within the words we own. So within Trusted Best and Now, you can rewind to what motivated Dr. Rassin to create Rassin Clinic. And it was essentially because he felt compelled to provide services of such a quality and of such a safety and outcome to patients heretofore not provided in the country, not in the public sector.
You know, he was dedicated to his patients, and that's what drove him. He wanted to make sure that his patients were always taken care of in the best possible manner. So whatever he did was aimed and focused really on that one premise. The family was there, but I have to say the patients were really what came first to him. And he didn't mind what was going on around him. If the police were chasing him, he's still going to see his patient first. That was his priority. So everything he did was built around that. How we built the hospital back in 1955 and opened, it was all about making sure the food was good, it was clean, it was good nurses, everybody was friendly. So it was the holistic view, if you will, before we all talked about the holistic type of medicine. And that's what he wanted to accomplish.
Like Dr. Rassin, the vision links the present to our future journey of pursuing all that's possible, but also reflects on the intent of the past. What compelled Dr. Rassin in the past, which is to provide safe, high quality, high tech, high touch, best care for patients. And we have simply, over the years, refined and elaborated that into certain words, but when you go back to what motivated Dr. Rassin, it was to create an environment in which patients can get the best quality, the most safe, the best outcomes, and he had some control over the decision making. And that is the same model 70 years later to now, and even as we project ourselves in the future, it is the one and the same to represent all that is possible in providing the best, the highest quality, and the best outcomes for our patients.
Well, you have to understand, my parents were both workaholics. My dad worked many hours. My mother was an operating room nurse, so she was working with him. I was just a child. They had to take care of me. They did not get babysitters, so I spent most of my time in the hospital, even during construction. I could tell you more about the construction of that hospital than I should be able to know. But that's where I lived, and went to St. Andrew's School across the street till I was 10 or 11. And lunchtime, I'd go across to the hospital and just hang out, basically. Bother the nurses, if you will, who took great care of me. They were really appreciated that I was there and kind of had to be there. And I explored the hospital on a constant basis during lunchtime, after. My dad always told me, now, we're going to go home for lunch. So I go across the street, we go home for lunch. He said, but you can't eat here. And I always made sure that I had lunch there as well, which is why I always battle with eating too much. But the food at the hospital was incredible. Mary was our cook, and she was an outstanding cook. And that's what he wanted. He wanted everybody to really shine and be the best so his patients could appreciate that. I got my MBA at the University of Florida, and after my MBA, I wanted to get experience before I came home. So I worked at the Mount Sinai Medical Center for 5 years. Then I wanted to broaden my experience, so I went to work with a for-profit hospital company, totally different type of hospital environment. Got my education through the experience I had with that for 6 or 7 years. And then I realized I'm never going to make a difference over there. I'm in America. So I said, it's time to go home. And that's when I told my dad I'd love to come home and help. And he said, no, you don't want to come home. So we had that little dynamic going on for a while. My mother convinced him that I should come home. So finally they agreed. And in 1979, I came home in January with wife, 3 children, 2 dogs, and $5,000 in my pocket, and said, we're going to change healthcare in the country. That was my goal. I wanted to bring modern care to the Bahamas.
I'm Dr. Barrett McCartney. I'm an anesthesiologist by profession. I did my training at the University of the West Indies for my medical school training, and subsequently thereafter went to the University of Western Ontario for specialty training in anesthesiology. When I started at the Rassin Hospital, actually I started there in 1983. When I first came back, I was there between there and the Princess Margaret Hospital. But like I said, full-time from 1985, I was at the Rassin Hospital. Back then, the hospital was only 20 beds. It did not have an intensive care unit. It only had 1 operating room. And even in that 1 operating room, they could not do any high-tech or sophisticated procedures. So back then, I figured we were about 40 years behind the state of the art. So it was a mammoth task to rapidly ramp up the technology and the services to being just under the state of the art at the time. The whole aim being to try and keep as many patients on island for care as opposed to them flying off to the US for any kind of major treatment. When I first started, I estimated 80% of Bahamian patients would fly away as soon as they were diagnosed with anything critical or major. I would say within 3 years, we reversed that ratio to where 80% of the patients stayed, and even our tourists stayed. I found they were even more challenging to get out of the hospital there and back to their home hospital. So that was really a stamp of approval to the level of services that we were providing at the time. I must admit that Dr. Rassin and Meyer Rassin at the time were very committed to the advancement of the institution, in that they had no qualms about buying a state-of-the-art anesthetic machine to begin with, which allowed us to do all the major procedures in the operating room, and they were fully in support of my effort to start the critical care unit, which again allowed us to take complete care of the patients even after they had major surgery. If they came in with major trauma, there was no need to transfer them to the intensive care unit at the Princess Margaret Hospital, or indeed even abroad.
It took about a year to convince my dad that, number one, we need the doctors involved. They're not going to be involved the way we have the current organization set up, being owned by one doctor, Dr. Rassin. So I said, you got to sell to these doctors, and you've got to move out of the building so it really becomes a neutral aspect. Now, from being a son, that's hard to do, to tell your dad, you got to give up what your life's work, and you got to move out and start fresh in another building. So I was torn, but business-wise, that was the only way this could work, because the doctors simply weren't going to utilize. I'd tried now for 6 years, 7 years, to get the business going, and only 1 or 2 doctors would support it. Now, all the doctors I talked to verbally supportive, but they didn't bring the patients. So we had to have another model, if you will, where they felt more involved. And that's where we said, okay, we've got to sell the building. So from a business perspective, it was an easy decision. From a family perspective, it was like, I'm going to just create disaster in my family. And hopefully I can mend that at some point. We finally got through that, and December 1st, 1986, we were able to sign the papers to sell to this group of doctors. And that itself was a moment that almost everything fell apart. Midnight the night before, I got a call from one of the doctors who said, look, another outside doctor not involved told me that if he buys in, he won't refer any patients to me, and therefore I can't proceed. That left me $40,000 short of the purchase. Midnight the night before I got to close. I called my lawyer, Dana Wells. He was fantastic. He said, tell you what, I'll put in the $40,000. So I was able to cover it. We were able to close at noon on December 1st. Fantastic moment in time, because that really began the next journey for the hospital to really move into the modern world, bring in the modern equipment, bring in doctors who could do a variety of things in the hospital with the patients. And now we're open up to the community, which is really what was the goal, to be able to have any Bahamian be able to access healthcare at this hospital.
Moving from a clinic run by an autocrat, right? And I want to be kind to Dr. Rassin's memory, but he was a great surgeon. He did a lot of surgery. He could deliver babies, he could do orthopedics and general surgery. He was your all surgeon. But he was irascible. And that translates into, you got to do what he tells you to do, or there's a problem. Moving from that, and as effective as that was for that time, into now an involvement of more surgeons. Now you into a team. So you move from an individual to a team. How do you get that? And that becomes one milestone, where the thinking no longer revolves around the decisions or the direction or the vision of one person. Now it's changing into a team. And so a big milestone would be when Doctors Hospital 1986 is created. It would have been created around the introduction of the first CT scan, but it also heralds the involvement of additional specialists. And that team approach changes then how decision making is made in Doctors Hospital. Moving from Dr. Rassin to Mr. Rassin also is a milestone, because now the administrative decision maker is a person trained in hospital administration. Now you into running this as a business, moving it from a relatively myopic, narrow-run organization into the fundamentals of what a business is.
Thank you. Thank you. Instead of the first 10 pages that I had, we've reduced it to one page that has a list of names. You'll be happy to know. I'd like to start with first reminding everybody that the reason we do this is to recognize individuals who've worked with us for a significant amount of time. They've invested in their lives for Doctors Hospital, our corporate culture, our patients, and this is a token for us to show our appreciation for spending that time with us.
Well, first of all, I want to make it very clear that healthcare is not healthcare in the public sector. Healthcare is universal and global throughout the Commonwealth of the Bahamas. Doctors Hospital has been around for many years and have carved out a niche that they do provide supportive, essential, tertiary healthcare services for the Ministry of Health and Wellness. So over the years, we have developed a strong partnership that programs innovative procedures that are not available at the public healthcare service system. We are able to move our patients to Doctors Hospital, who take very good care of our patients by way of the surgical and cardiovascular interventions and bring them back to our facilities. So the partnership has grown into something very special. And a few months ago, I alluded to the fact that Doctors Hospital is definitely involved in many of the healthcare decisions that take place in the public sector.
My role in Doctors Hospital as Chief Executive Officer is essentially being the number one associate. By example, it's the leadership position that everyone looks up to and expects to just set the tone, set the direction. A lot of what I do is to explain the vision, and the vision has a lot to do with what makes our health system best positioned so that there is no question about Doctors Hospital's role in delivering private health care in the Bahamas and beyond. We talk about a vision that takes us into 2030, but let's just say looking at as far as we can go, Doctors Hospital is continuously regarded as the best. And so being that vision setter, tone setter, being that example, being the representative of Doctors Hospital, that moment by moment pretty much defines what the position is and what the expectations are. Of course, there are strong leadership expectations and leadership of an amazing team. And at each level, as you move throughout the C-suite and down into the upper executives, we have some amazing high performers. And I have the privilege, if you like, to coordinate the activities of these high performers. And to me, it's probably one of the most rewarding parts of my job to determine how can I best help them to become successful in what they do. And then, of course, it's all about the associates. And I think the magic in what I do is my interaction with associates, sometimes one-on-one interactions that turn out to be either igniting, very igniting for them, or very inspiring for them, sharing my story of relatively simple, humble beginnings, and then just that persistence, that perseverance, that patience that will, I believe, and by my example, get you to where you're trying to get to successfully, whether that career is in the clinical side, patient care side, or whether that career is in the support services side throughout the health system. So that's a tour of the essential duties and responsibilities of my job as CEO.
A significant expansion in 1993 and becoming a publicly traded company in 1999 marked new chapters in its growth.
As we get towards 1997, 98, and we look at, this is the first foray into we should become a health system. And in doing so, we need to have a public offering and become a publicly traded company. Now that's a key decision maker, because that means that today over 1,000 shareholders benefit from what Doctors Hospital Health System is become. So the birth of Doctors Hospital Health System sits around 98, 99 with the public offering, and then we have the creation of Doctors Hospital West. We also got into the insurance space, and we were key creators of what now is Bahama Health. That did not survive with our involvement. It continued to be run by Bahama Health, and it seems like now we come full circle as we start to create our own Loyalty Advantage membership program. But back then, creation of the health system, the creation of Doctors Hospital West, improving our main facility, and launching Bahama Health were key objectives of becoming a publicly traded company.
Today, Doctors Hospital is a 94-bed multi-site health system offering comprehensive inpatient and outpatient services.
It was at a transition of extending all of the traditional services that you would find in an acute care hospital, but extending them into this 4-story complex. So that evolution would involve increasing the inpatient capacity. So we moved from a 2-story Rassin clinic with 25, say, patients able to be accommodated into a 72-bed facility, which included a clear expansion of all of the traditional areas, med-surg, obstetrics and gynae. We extended our operating room capacity, our critical care capacity, and we had a significant expansion of the emergency room. And the emergency room was particularly near and dear to me, since I was responsible for the physicians who provided that service.
My name is Dennis DeVoe, and I'm the Chief Financial Officer for Doctors Hospital, and my primary role is to support with the financial plans of the healthcare system. A day in the role of CFO at Doctors Hospital starts with thinking about what's most important to our patients and what's at the top of their minds, and how I can ensure that our frontline caregivers have all that they need really to support patient care expectations. And our patients expect high quality, they expect high touch, and they expect an amazing healthcare experience. And so my job really is about supporting the people that are on the front line of providing what the customers expect. And then I back into what that means in terms of some of the more financial details, capital planning, expense planning, developing forecasts, and all of the traditional things that financial people do. But what anchors all of that is, what do our patients expect from Doctors Hospital?
My name is Shobana Nair. I am from India. When I moved here, my plan was to stay here for maximum 4 years and then go back home. And now today is my 21st years working in a Doctor's Hospital. That's how much I like here, and it's like my home. It's like my second home. When I came in, I heard how this Doctor's Hospital started. It's like a very small facility with 2 beds in ICU. There was no ICU first, and then they started with 2 beds, and it's only 1 floor, and then they extended, and now this is what we're seeing now. Each time I see a good place, a better place, expanding or improving the care and the facility itself. And of course, as an associate, I get the benefit as well, same time. And I grown from, as a nurse, I grown to a different level, and each department when you go, you learn more. So now I have a confidence that I can work anywhere in the hospital.
My name is Chazelle Smith. I am the Director of Outpatient Clinics at Doctors Hospital. I've been to Doctors Hospital almost 6 years in April, and I mainly work with outpatient clinics and outpatient services. When I came to Doctors Hospital, I met Doctors Hospital with 2 buildings, the main hospital on Shirley Street and Doctors Hospital West on Blake Road. The outpatient clinics and outpatient services are all the other buildings that have been built up since. So we have several buildings in New Providence. So we have clinics, Centerville, Dowswell Street, Carmichael, Paradise Island, Bahamas. Also, we have clinics in Grand Bahama. We have clinics in Exuma. We're opening a clinic soon in Eleuthera. And so all of those things that are outside of the hospital are what we view as the outpatient services.
From advanced imaging technology and specialized care units, it stands as one of the Caribbean's most modern acute care facilities.
Our investment strategy does not have a return on investment requirement for things that speak to patient care and quality. We're going to do those things. And I think as a CFO, it starts with that fundamental understanding of the importance of high quality patient care. And so we put that right out front. We're going to be best in class. We're going to have market leading technology so that people get the diagnostics and the care that they need. And we're not going to subject that to the traditional criteria that financial folks might obsess about, calculations about return, because that's very short-sighted from our perspective, and we want to think about, fundamentally what patients would want, and they want to have the equipment in the room when they need to have the lab test done to ensure that it's done at the highest level in the country.
Core reason is why we are different. It's because our focus isn't on the bottom line. A lot of people see us as the business and it's all about the profit. Reality is it's all about the quality of care. It's all about the service we provide for each patient. You know, it's the old adage, in the business you focus on the top line, not on the bottom line. And that's what I think we do better than anybody else. We focus on giving that quality of care, that smile, the ability to relate to our patients. That's got to be our driving force. And we've got to make a profit to stay in business. That's a reality. But if we focus on the top line, we focus on giving good service, treating people well, then the bottom line takes care of itself.
Accredited by Joint Commission International since 2010, Doctors Hospital embodies the values of welcoming, empathy, commitment, accountability, respect, and excellence.
Two very important things in the first decade of this century. One is the initiation of the Joint Commission International Accreditation Survey process. And once we got that started in 2010, 2011, it took us about 10 years from 2000 to get prepared for the international body to survey us. It's not an easy thing to be ready to be examined. But once we got that going in 2010, 2011, this year we get into a 6th or 7th successful accreditation with the Joint Commission International. So that was one thing that occupied a significant amount of my focus in the first decade.
The Board of Directors and the Executive Management Team of Doctors Hospital are certainly proud to announce that Doctors Hospital is the first hospital in the Caribbean to achieve international accreditation from Joint Commission International.
Health City and Doctors Hospital have a wide-ranging relationship that goes back many years. Because Doctors Hospital was the first private healthcare institution in the Caribbean to be Joint Commission International accredited, and we actually have the notoriety of being the second private hospital in the Caribbean to receive the same accreditation. We went ahead and had conversations with Doctors Hospital, and eventually, as we added our radiotherapy unit, as we added our neonatal unit, which is now open with our new hospital in Camana Bay, all of the conversations converged, and it just made sense for us to have a partnership towards obviously the benefit of the patients in the Cayman Islands, but also for those in the Bahamas.
Demonstrating resilience and adaptability, Doctors Hospital West became the national center for treating critically ill COVID-19 patients, underscoring the institution's pivotal role in times of crisis.
When COVID-19 gripped the Bahamas as it did the rest of the world, I remember feeling like we had a zero-fail mission, and I was consumed about thinking of all of the ways that we could fail and making sure that that didn't happen. And failure meant running out of supplies, not being able to adequately test patients, not being able to intubate or ventilate patients because we didn't have equipment or physicians who had the right PPE. So I was consumed with the fear of failure, and I realized how catastrophic that could be, not just for Doctors Hospital, but potentially for our country. And so that motivated me, every day to get up and think about ways that we can ensure we preserved this critical lifeline that Doctors Hospital provided for the country. And a core part then of my responsibility was to stand up our COVID-19 testing operation. And in the early days, that was mostly about PCR testing, we all remember, the gold standard. But that moved beyond PCR testing into a more preventative and a more screening modality. And we would have delivered, as a result of that, north of 1 million COVID tests, played a critical part of reopening of the economy of the Bahamas, but most importantly, limiting the spread of that infection by testing, letting someone know that, listen, you've got COVID and you don't need to go to work, or you need to quarantine yourself within your home. So, that was really a turning point for me in my role at Doctors Hospital, moving very much out of the traditional confines of finance and getting deep now into healthcare operations.
Once our associates were exposed to COVID itself, the associates were tested by the institution at the hospital's cost, not at no cost to themselves. They were treated if they needed to be treated, followed up by Dr. Warner Rogers to make sure they were all okay before returning to the work environment.
So my introduction to COVID and the associates was that we had an associate who strongly suspected of having COVID. And she was supposed to be admitted. So I was actually in the hospital at the time, in clinic, and was asked to evaluate her and to get her admitted. So if you remember back in the day when COVID first started, it was donning, everything would look like a big spacesuit. So I remember having to put this spacesuit on to escort her up to the floor, and the corridors were empty, everybody just scattered. The elevator was empty, and then we took her upstairs, and the nurses were on one side, and we took her into the room, put up the IV on her, came out, took everything off, and it was like, whew, what a rush. And then, here we go. And if you remember when COVID started, everything kind of shut down. So as a primary care physician, the patients were like, we're not coming to the hospital. So my job was to monitor the associates we had in the hospital. So I kind of became responsible for them.
My name is D'Angela Sweeting. I'm one of the registered nurses and also charge nurse stationed in the emergency room at this time. As a nurse in Doctors Hospital, I would say that I've grown tremendously. Coming into it during COVID as a fairly new nurse, I learned a lot even though I was terrified. It allowed me to overcome my barriers, and everything that I felt like I couldn't do, I was able to do. So I somewhat shocked myself during COVID as well, managing intubated patients even though I was scared of ICU, didn't want to deal with ICU patients. But coming into COVID, that's what we had to do. This mainly was our isolation room. We'd utilize it just to limit exposure. However, once COVID became more rampant, we had to use the whole emergency room. So the whole emergency room was basically like a ward. So we opened different sections behind patient registration, which we called the walk-in wounded, to limit exposure to those who would have came in with non-related respiratory virus illnesses so that they wouldn't be exposed to COVID. And that also assists us with opening our various clinics so that we can somewhat mitigate the crowd that's piling up in the emergency room, so that if those came in with non-respiratory illness, we were able to send them to CMC, DH West. We also have Bahamas, Paradise Island, Carmichael Road, we're expanding. So it assists with mitigating the crowd in the emergency room.
So my role in Doctors Hospital's response to COVID-19 started primarily in COVID testing. So I was instrumental in the opening of our first COVID testing site, and then thereafter several COVID testing sites across the country. The world stopped, but healthcare had to continue, and that was difficult. And so we had to figure out how we were going to contribute to reopening the Bahamas. And so one of the main things we did was we didn't just do COVID testing, but we looked at what return to work could look like in a safe manner. So in a lot of ways, not just our COVID testing, but the algorithm and protocols that we developed at Doctors Hospital that were scientifically based led to the reopening of the country. There were many companies that were routinely testing their staff and screening their staff. Companies in hospitality, construction, IT, all kinds of services, and we were the ones who drove that. They were testing their staff. They, in some sense, were testing their guests if necessary, and it was allowing business to continue safely, people to get back to their jobs, and for us to eventually open our borders.
It's been nearly 15 months since cruise ships last sailed the crystal waters of the Bahamas. It was with tremendous joy and pride that the Ministry of Tourism welcomes back our longtime partner, Royal Caribbean Cruise Lines. Director General Joy Gibberlou shares why this moment is so important for the Bahamas.
People have arrived not just yesterday, but several days before. So they're arriving at the airport, getting in a taxi, going to a hotel. And from the expressions on people's faces, all of us have commented, see the big smiles. They're getting to experience firsthand, certainly what Nassau, New Providence is like. And I can assure you out of that, we're going to see people who are saying, I want to come back, but come for a stay over stay.
Doctors Hospital officially opening the doors to their latest medical facility on Paradise Island today. They're promising state-of-the-art health care to every patient that walks through the door. The Chief Financial Officer, Dennis DeVoe, says through the medical facility's expansion, the Health Corporation is fulfilling its mandate of affordable and top-notch health care through modernized health technology.
Our strategy over the last couple of years has been all about growth. And growth simply means that beyond providing care to people at our main facility, which is where all of our history is, and while we cherish and respect that history, it really is about looking outside of our main facility to where other healthcare needs exist and how we can meet those needs.
New initiative called LAMP, which is a loyalty advantage membership plan, providing its members access to free waivers and discounted on outpatient and inpatient services at the hospital. Manager of Finance and LAMP Kalai Bathel emphasized the benefits the plan has to offer for those who are seeking accessibility and affordability.
Traditionally, if an individual wanted to access healthcare services, they would really have two options. They either pay out of pocket, we call that a self-pay, or they would use their insurance. But there is a large group of individuals who can't do either of those things. They don't have the funds in their accounts to pay for oftentimes costly services at a point of sale price. And there are those who may not have access to insurance for a number of reasons. And so LAMP provides an alternative, another avenue for them to access those services. But with LAMP, it bundles all of that together into one monthly fee. And so now you know that I just have to pay this monthly fee. And when I go to my doctor's hospital physician, then these services are covered. It makes the healthcare journey a lot less stressful. It makes it easier to plan. It makes it easier for families to access healthcare services. And that really can make all the difference in the lives of people. And that is the beauty of the program.
Beyond patient care, Doctors Hospital invests in the future of Bahamian healthcare through scholarships and educational initiatives, nurturing the next generation of medical professionals.
When I first received word that I got the scholarship, I was so excited. It was a chance to make my dream come through. It was a step in the right direction. My college journey was one of uncertainty, but guided by faith. So when I got it, I'm like, okay, this is a God thing. I'm on the right track. Thank you so much for using Doctors Hospital and the Scholarship Foundation to be a part of this. But when I got the second scholarship that allowed me to complete my degree, I didn't have the words. There were a lot of tears and a lot of gratitude. Saying I was grateful doesn't do it justice, but it meant a whole lot.
The way the Meyer Rassin Foundation Scholarship has helped to propel my future is it gave me an opportunity to study in Amsterdam in the Netherlands. It was in a pretty arduous time during COVID, which was in 2020, and there was a lot of unsureness around jobs, around everything in life. Everybody was just profoundly affected by this pandemic, and for me, I got the opportunity to go ahead and study. In reflection, and up to that moment, it finally dawned on me wow, you have the opportunity to go and study in Europe. And I've never been to Europe in my life. And just all of those emotions just came at once, and all I felt was just joy, absolute joy.
Well, I think our future is very, very bright. And certainly I'd like to see us extend our ability to attract patients, not only the entire Bahamas, but certainly the entire region, be it down the Turks and Caicos, be it the Eastern Caribbean as well, become a regional referral center and become certainly a center of excellence for many of the procedures that we do.
70 years of excellence really speaks to our rich heritage. And it really is an amazing story in the post-colonial era of what Doctors Hospital has become, and certainly where we're going. And so for me, this is all about standing on our rich legacy, but boldly delivering on some important initiatives for the future. Healthcare in the communities where we live, national healthcare capacity, serving communities that have historically been underserved. And so it's continuing that legacy, building upon excellence and not being afraid to take on what might seem impossible. I think COVID taught us that we had to do the impossible. We had to care for the sick. We had to test the country and our guests. And so that legacy certainly is one that I take as a challenge to carry it on, to build upon it, and to ensure that we sustain that excellence to 2030 and beyond.
We're fully aware that when it comes to culture, we have to be very mindful about what people feel when they come into our space and how they react to our processes, and whether these processes are either frustrating them, impeding them, or are these processes facilitating them and leading them through the whole patient care. We know that patient care, by its nature, is full of fear, anxiety, and uncertainty. And that makes us uniquely different from hospitality. People don't want to come to us normally. And by virtue of them being with us, it is clear that there's something wrong that we're trying to fix. And so a key part of what we have worked on over the years and continue to work on is managing fear, anxiety, uncertainty, and understanding that that is going to come part and parcel with whatever illness or injury the patient presents with.
It is very true. My dad was driven to help his patients and did everything he possibly could. And I became driven to make a difference in people's lives who I may never meet around the world. And that's what I loved about Rotary, that I truly could see that I made an impact. My dad would be extremely proud of what we've accomplished. Why? Because again, Dr. Digges, and I'm really happy that he's the one who took us to the next level, because his focus is on how do we give the best quality of care. And that's what my dad wanted. So there's a symbiosis there that brings us together. My dad would be really happy that we're really trying hard to give quality, not only in the care itself, but making it easier access to care by providing all the facilities that we have today.
The overall legacy of Doctors Hospital, from its beginnings with Dr. Meyer Rassin's practice and clinic to Doctors Hospital Health System today, and you reflect on 70 years, I think the enormity of that is tied to the difference that we have made and the difference that we continue to make by simply being present in the Bahamian communities, making that difference in private healthcare. And you can pull any set of numbers and start to see that Doctors Hospital is, paying its way, meeting its obligations, providing the ability for so many people to be able to themselves live, having about 1,000 associates, full-time equivalent associates today, being involved in so many life-changing, life-supporting events, whether that's in healthcare or education or related. Doctors Hospital has made the difference over the years. That is what I regard to be the important reflection from now and 70 years ago. It started back then, and we're continuing it and exploding it right now.
70 years of healthcare excellence, a story of the legacy of Doctors Hospital.